Avoid these 3 things if you want healthy teeth and a healthy mouth. Hi, my name is Whitney and I'm a dental hygienist. If you're new here, welcome. If you've been here before, welcome back. Today we're talking about what to avoid in order to have a healthy mouth. Number 1, clenching and or grinding your teeth, also known as bruxism. It creates so many problems and it does not only happen at night. So similar to constantly reminding ourselves to sit up straight, stop slouching, and relax our shoulders, oftentimes teeth grinding or teeth gritting, biting together really tight, clenching, it can become a habit where we have to consciously continue reminding ourselves to stop. Now, if you are sleeping and you have bruxism, then you are not consciously aware of what's going on. You can't just tell yourself to stop like you would during the day when you're awake. In addition, teeth tend to become much more damaged with nighttime grinding as opposed to daytime grinding due to the force that you apply when you're asleep. It's a force great enough that you would never consciously clench that hard when you're awake. Your brain would tell you to stop if you were awake, but since you're asleep, wild things can happen. Now, why exactly do you want to try to avoid clenching and grinding? The main reason is damage. It can cause so much damage to your teeth, such as cracks and chips, which can lead to needing fillings and crowns and sometimes even root canals, which can get super expensive. Also, headaches that can ruin your quality of life, severe facial or jaw pain, again, disturbing your daily life, TMJ disorder. You might notice clicking or popping when you open and close your mouth. So, how do we stop? Treating the root cause will treat the bruxism. However, unfortunately, we don't 100% understand what causes bruxism yet. However, research shows it may be a combination of things, including stress, that's a big one across the board, other emotions such as anger, frustration, or tension, coping strategies, or a habit during deep concentration, personality types that are aggressive, competitive, or hyperactive, genetics. Sleep bruxism specifically tends to occur in families. So once you treat the cause, if you can treat the cause, such as stress reduction techniques, there is a chance you will also stop the clenching and grinding habit. But until then, night guards is what's going to prevent you from damaging your teeth. For example, if you grind through your hard plastic night guard, it's better to need to buy a new night guard as opposed to needing to buy new teeth. Because fixing teeth due to bruxism damage generally requires more than just fillings. You can bang on those teeth together so hard that you will need crowns, root canals, more involved dental procedures. So the more affordable and tooth-saving approach would be to wear a night guard to prevent the tooth damage in the first place. And if you notice yourself clenching or grinding during the day, consider wearing your night guard during the day as well, especially during stressful situations, such as when you're driving in traffic. I actually have a lot of patients that bring their night guard with them in the car because they have a stressful commute to work. And lastly, with the clenching and grinding, I have to mention, those with sleep apnea experience many of the same warning signs, like they are often known to clench their jaws at night. Sometimes the first hint of undiagnosed obstructive sleep apnea is clenching and grinding your teeth. So always schedule a sleep test with your physician if you think this might be you. Number 2, things to avoid. Now, instead of avoiding candy, thinking you will prevent cavities, consider avoiding carbs. Most people are unaware that fermentable carbohydrates are worse for teeth than candy. Fermentable carbs are things like white bread, graham crackers, chips, pasta noodles, and goldfish crackers. And the reason why fermentable carbs are so bad for teeth is because they specifically break down into sugars while they are still being chewed in your mouth. These sneaky sugars from fermentable carbs tend to make the mouth more acidic, which increases your chance of tooth decay. I mean, think about it. Eating a cheeseburger, the bun, the breading can really get stuck in your teeth, right? Whereas a candy, like dark chocolate, can easily rinse off your teeth. So plain chocolate is technically healthier for your teeth than bread. So of course, opt for fresh fruits when you can, vegetables, meats. Also, I always like to tell my patients that snacking is the absolute worst for teeth. It's actually better to eat all your snacks at once because then afterwards, it gives your saliva time to neutralize the acidic pH in your mouth from all the sugar, as opposed to constantly making your mouth acidic by snacking on foods all day. So eating a big meal is actually healthier for your mouth, to eat everything at once as opposed to snacking throughout the day. And when you're eating a big meal or any fermentable carbs, always try to eat pH neutralizing foods last, because an acidic mouth can increase your risk of cavities, like we said. So you want to eat the tooth healthy foods last, which are most vegetables and fruits and yogurt if it's sugar-free, and my favorite, sharp cheddar cheese. Very neutralizing. So for instance, if you're eating cheese and crackers, you should always have the cheese be the last thing in your mouth to help neutralize the acidic pH in your mouth from the cavity-causing crackers. Also, rinsing with water after every meal and every snack will also help neutralize the mouth and rinse away any residual food, even if it's healthy food. You don't want food sitting on your teeth for a prolonged period of time because that can increase your chance of cavities and gum disease. Simply swishing with water helps a little bit to neutralize the pH in your mouth, thus preventing dental disease. And lastly, chewing xylitol gum is another great way to help neutralize your mouth after eating cavity-causing foods. Xylitol is an ingredient that is found in most sugar-free gums. Just read the label, just check it out. It can actually help bring your mouth back to a neutral pH and help repel plaque, thus helping prevent cavities. And number 3, avoid alcohol-containing mouthwash. Now, there needs to be more studies on this. Most of it is very subjective or anecdotal. However, as I've seen in my clinical work, and some studies have suggested that mouthwashes containing alcohol have the potential to dry out your mouth, and since dry mouth increases your chance of bad breath and raises your risk of developing cavities, it might be something to consider. I do recommend alcohol-free mouthwash to most of my patients, especially those who already have dry mouth or are very cavity prone. Also, because there just seems to be more adverse effects with alcohol-containing mouthwash. Again, further long-term studies are needed to confirm these findings. So if you really like the burn of alcohol in your mouthwash, it's okay to use it, but definitely avoid it if you have dry mouth. Also, avoid it if you're undergoing cancer therapy, you're a small child who might accidentally drink it, and or if you are someone who is prone to thrush or immunocompromised, or if you have a history of alcoholism, alcohol dependency, or if you're a recovering alcoholic. For all those instances, I would really try to avoid alcohol-containing mouthwash altogether. Stick to the alcohol-free versions. If you're someone who likes it and you're having no problems, it can't hurt to swish with water afterwards to help neutralize the pH in your mouth and or brush your teeth after using it. But for the purpose of this video, most importantly, just know that mouthwash is not something you need. Of course, there is a time and place for cavity prevention mouthwash, sensitivity mouthwash, alcohol-free mouthwashes can be a great addition to your oral care routine at home. However, nothing replaces the mechanical removal of plaque with your toothbrush and your floss and or other interdental aids such as water flossers, proxy brushes, floss picks. It's much more important to make sure your brushing and flossing techniques are good, that they are solid before you even think about adding a mouthwash into your routine as well. And speaking of your home care routine, if you're interested in creating the perfect routine to prevent major dental issues and costly dental visits, make sure to click the link in the description or in the pinned comment below to sign up for my free oral care guide and discover all of the essentials for an effective oral hygiene routine. This guide is an action plan for preventing and maintaining a happier and healthier smile. And I hope this video helped you. Please like and subscribe and turn on your notifications if it did. And if you want even more teeth talk, you can visit my website teethtalkgirl.com and hang out with me on Instagram at teethtalkgirl. Peace, love, and teeth.